We have something called International Infection Prevention Week as well. This came as news to me as well. Then I did some research on it and found that it's been there since 1986. So then I started thinking, how is it relevant in my oncology practice? Infectious Prevention Week. Then realized it has everything to do with my oncology practice. It has everything to do with my patients. We have a hospital infection control committee who takes care of where we keep our sterilizers, what part of the floor is cleaned, how, where do we use regular footwear, where do we use hospital based footwear, how frequently should the countertops be cleaned. So therefore there is a huge science behind this infection control to prevent spread of infection. Guess what? The most important thing is, yes, you guessed it right, hand hygiene. And this is for our healthcare workers, and very important. If I've examined a patient's foot, then before I touch any other part of the patient, I should again sterilize my hand with a sanitizer and then touch the other part. And this is so not just between one patient to the other, but in between while examining the patient, before touching my pen. So we need to be very cognizant of it. It becomes into a lifestyle activity for us doctors and healthcare professionals to ensure that we don't transfer the patient from his leg to his face, or from one patient to the other, or from him to me. Who's on chemotherapy or any form of radiotherapy is prone to develop infections. This does not mean that you put them into a separate clean room and or a separate cell and then keep them away from the community. It's important that the patients mix with their family, play with their children, because it brings a large amount of emotional well-being for the patient and as well as for the family, that everything is normal. You should be careful, you should sanitize your hands, you should ensure that you wear clean clothes, you should have a bath on a daily basis. Simple stuff which our parents taught us and what our teachers taught us in first standard, that is all that is needed to take care of your patients.